as well as being great, as well as being part of this project. And I am Virginia Rowthorn, and I am the Assistant Vice President for Global Engagement at University of Maryland, Baltimore, and co-director of the Global Learning for Health Equity Network, from which this grant opportunity emanates. So Yolanda, if you don't mind moving to the next slide. First of all, I wanted to share with everyone what we mean by global learning, because there are many phrases for what we're trying to get at with our project. Yolanda and I just published a scoping review in the Annals of Global Health about global learning, and we looked at other sources that use terms like this or other related terms. And in that article, we provided this definition. And our definition is: global learning for health equity is the practice of engaging with, exchanging, and adopting health equity promoting ideas and interventions between communities in ways that foster implementation benefits that are reciprocal and beneficial to both. So what I want to emphasize in our definition is that we are focused, well, we are based in the United States, and we are quite focused on searching the world for health equity innovations and ideas and bringing them to the United States, but also clear that we don't want to be extractive in that way. But we hope when global learning happens that it's not extractive and it leads to mutual benefits for both sides of the equation. But I should also say that there are other terms actively in use. In fact, recently, the NIH Fogarty Institute International Center had a conference where they used the term reciprocal innovation. And in a paper just published by Thomas Soares, he defined reciprocal innovation as bidirectional, mutually beneficial research and translational research with long-term global health partnerships. So that term is very much used. The term reverse innovation was often used in the past, but it's gone out of favor because it implies a correct direction for innovation. And so that term, while popular in the past literature, has gone out of style. And you'll also see the term global to local or co-development. So we wanted to share this so you understand that we have this meaning for global learning, but we understand that there are other terms that are quite related. So we also want to just be clear that we understand that health equity in the United States, we've got a long way to go. And we understand that global learning is just one tool in the toolbox of potential ways to address health equity challenges. So you can see from this graphic, there's health equity challenges, there are solutions, and then there's global learning in the middle of that. So we don't pretend that global learning is the only way to address health equity, but there may be ideas that haven't been tried that we can discern from other communities outside of the United States, and we'd like to encourage that, looking for those ideas and adapting those appropriately to the United States to address health equity. And finally, before I turn it over to Yolanda, I would like to say that we are using quite a broad definition of health equity because we understand that there are many projects you may be considering that relate to health equity or lead to health equity. So we use this definition that is Robert Wood Johnson Foundation's definition. And it's that health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education, housing, safe environments, and healthcare. And using that definition, you can see that projects related to education or to the climate or to gender equity could very well fit in with our broad definition of health equity. And just before I move forward, I just want to say that I forgot to mention at the beginning of when I started that our project, the Global Learning for Health Equity Network, is funded by the Robert Wood Johnson Foundation, and we're very grateful for the support they have given to our Global Learning project. So Yolanda, I'll turn it over to you.
Sure. So welcome, everyone. And I'm Yolanda Obalu. I am an associate professor and co-director for the Global Learning to Advance Health Equity Network. Please feel free to put any questions that you may have in the chat as we move along, and we will be monitoring the chat throughout. Unfortunately, as I'm sharing the screen, I'm unable to see your lovely faces, but at the end, we will stop sharing and be able to have a very intense, hopefully, conversation about what we're sharing. So we're excited to be able to share information about our planning grants that will be available. If you've had a chance to read the call for proposals, you will see that the call for proposal requires that the planning grants be embedded and use our Global Learning to Advance Health Equity framework. Our framework is image. And this model was created in 2022 by the Global Learning for Health Equity Network. The center of the model reflects the core values that we believe must be part of global learning for health equity. And these include trust, humility, respect, and reciprocity. We believe that if these values are not embedded into global learning projects, the initiatives that come out of this may be extractive or appropriative, thereby reproducing historic inequities in the diffusion of knowledge. The domains around the edge of the model represent the different dimensions of global learning, from impact to share. Impact is the earliest stage because we think before we even think about developing a global learning for a health equity project, the first question needs to be, what health equity outcomes in my community does my community want to achieve? This question could allow you to really explore innovative ideas, to identify an idea that works, to really be able to contextualize that idea in consideration of the context, and to come up with a plan to collaborate with the community, but also with global innovators of these ideas. We believe that as you look at this image, you will see that people can enter at any stage. We know from our experience in global learning that some people have entered into Identify. Some people have adapted a global project and then went into other areas of our global learning model. And so we believe that communities, health equity promoters, and researchers can proceed through the stages in diverse ways and in different orders. As we thought about how people might be wondering how to jump into this space of global learning for health equity, we're reminded that that the United States does not have a monopoly on good ideas. There's good ideas all over the world that can be implemented to advance health equity. The University of Maryland is the primary hub of the network, but we're privileged to work in close collaboration with national global learning for health equity experts, like our colleagues from Athens City County Health Department, the COPE program in the Four Corners in the region of the Navajo Nation in collaboration with Brigham and Women's Hospital, Montefiore Health and Albert Einstein School of Medicine in the Bronx, New York, and Alex Plum from Henry Ford Health Systems and now Corner Health System in Michigan. Leveraging experiences from these global learning experts in our work in various communities, we have derived some lessons that have allowed us to be able to implement these projects. These projects include in Athens, Ohio, learning how to develop a community social participation model from Latin America. In the Navajo Nation, our partners have been able to address child development using models from Peru and Cuba. In the Bronx, New York, we've been able to develop stronger community health worker models by learning from Togo to the Bronx, New York. And in Baltimore, strengthening family social connections by learning from Brazil to Baltimore. So as we thought about the lessons learned, we were able to share kind of detailed case studies on our web page about each of these projects. And we would encourage those that are interested in applying to look at these and to look at the case studies and learn more about them. When I think and reflect back on the work that all of our initial partners have done in the network, we all entered that global learning model in different ways. For my project in Baltimore, I used 2 small planning grants with my Brazilian partners. First, to do a pre-implementation assessment to really understand the intervention in Brazil and to understand feasibility in Baltimore. For a second planning grant, I used it to better understand how to measure social connections using a cross-cultural assessment where we measured social isolation both in Brazil and Baltimore. And from that, both my partner in Brazil and my research team in Baltimore, we were able to learn different lessons that helped us to improve social connections and the ability to address social determinants of health on both sides. So the purpose of this call is because we now have a call for proposal. We're giving away planning grants that for individuals that are interested in learning about global learning. The proposals are due on February 8th, 2023. The detail for the proposal is in 2 documents available on our webpage, the call for proposal, and a second document that goes into detail on the Global Learning for Health Equity framework, even providing ideas and examples of how you could begin the process. The grants will range from 30 to 50,000, and we will be able to provide grantees 6 to 8 grants for 18-month projects. In terms of who's eligible to apply, we would encourage a wide range of organizations, community-based, public health departments, individuals from academic institutions, as well as others. Partnerships with community-based organizations and health equity organizations are highly valued and encouraged. In fact, at least one team member should be an individual from a community-based organization, a local community-based organization. We're also seeking organizations that have a demonstrated history of community engagement. When we go back to the model, all domains, individuals are eligible to apply at different domains on the model. Some individuals that are interested in global learning may have no experience in global learning and may be at the earliest domain, identify, while others of you may have experience and could apply at later domains, including collaborate, implement, and evaluate. The proposal, the elements of the proposal involves the application process, which is basically your biographic information, project title, project summary, and proposal. But in addition to that, you would have to upload several other documents, which includes a work plan, a budget, and a budget narrative. For grantees that are awarded, and for those of you that are also on the phone that might not be awarded, one of the really important parts of this process is that we will provide post-award support for grantees on how to implement global learning for health equity. And through that process, we will be having resources available for global learning on our website that will be open and available to others. So each grantee will receive technical assistance with a mentor, someone who's had experience in global learning in the past that can be available for coaching and mentoring. We'll have a kickoff assembly that will be required and regular check-ins with grantees. And then we will also have learning programs and resources on various topics, such as how to identify an idea, how to build buy-in at your organization for global learning, and how to engage community members, as well as how to use implementation science to measure process outcomes. So we wanted to spend the bulk of our time answering your questions. So that is a very quick overview of the Global Learning for Health Equity call for proposals. And you can contact the network with additional questions at the email below. But we really want to spend most of our time today opening up an opportunity to answer some questions that you might have about our call for proposals. So I'll stop sharing now and open up for questions.
Hi, Dr. Omalulo. Deb Schofield here. How are you doing?
Hi, Deb. Good to have you here today.
Well, it's nice. I'm sorry, my camera's not working today, so I apologize you can't see me. It's so nice to see your face, and I'm just really proud of your work. For those of you who are on the call with me, I've come from the University of Maryland, and I'm now at the Greater Baltimore Medical Center. And I just wanted to briefly say that, as you know, Greater Baltimore Medical Center is a community hospital which is independent in northern Baltimore County. Now, we do have, and I have learned recently about our outreach in the Baltimore County neighborhoods for the last 2 years. So I wondered a little bit about what the characteristics of the community outreach needed to look like. If you could just kind of, give me a sense of, how that looked. I could certainly get a community partner, but I just wanted to get a better idea of that.
So thank you, Deb, for that question. In terms of community engagement, our vision is that the challenge that individuals seek to address with the Global Learning to Advance Health Equity grant would be a challenge that is identified by the community, that it is something that the community sees as a challenge and something that they wish to address. From our experiences with our global learning projects in the past, we found that communities buy in better to the idea of global learning when you're addressing an area that is critical to them. So we have Alex Plum from Henry Ford Health System. So Deb, I know that you're at a health system. And Henry Ford Health System is a model where they've used global learning for addressing disparities or inequities within the community. But they've also used global ideas to advance concerns related to their healthcare workforce. For example, building hope and resiliency in healthcare workers, learning from a model that strengthened hope in healthcare workers in Rwanda. So you could think about it from the community, addressing community inequities, and certainly they have those in Baltimore County as well as in the city. But I think working with a community partner that can help you prioritize the needs of the community is critically important.
Many thanks. Makes sense.
Can I just add, Deb, and I just want to say for anyone joining the call, I am not driving. I'm sitting in my car. I'm in transit today, and I know this steering wheel is not a good look. But I want to add that I think, Deb, if you're working closely with community organizations, but haven't addressed the topic of global learning yet, or trying to identify an intervention overseas, you may even be at working with the community to identify what are the most pressing health equity needs. There is still an opportunity for this grant proposal to have those conversations. That would be an appropriate project to start to identify what are the most pressing health equity needs that could be met by an intervention discerned from overseas, and then identifying an appropriate intervention. So just because you haven't sort of dipped your toes into the field specifically, we do want to bring people into the network who are open to this idea and want to work with communities to identify a global learning idea. So just to add that.
Thanks so much.
Hi, my question is the implementation in, I believe based on what I read, it has to be either in the US. I'm bringing something from outside of the country that I've learned there and implementing in the US. Is that what it is? Or is it like the other way around?
Sure. Thank you so much for that question, Remy. We have received emails with the same question, so this is important. This project is really focused on what we can learn from the world. So it's not developing projects that are share like an American-based intervention in another country. The goal of this project is we believe that health inequities are stubborn, that we've had a really difficult time addressing health inequities. And there are opportunities for us to learn from the world different, new, innovative solutions. So we're seeking, for example, what can we learn from Rwanda? What can we learn from Nigeria? What can we learn from Europe? So it's really important that the idea is a global idea outside of the US coming into America.
And I don't know if this is probably more of a statement, but I found that, I don't know, I kind of flipped the script in the sense that I see what we consider third world countries as first world, because, you know, America, the United States is a very young nation. And we sometimes think that we are the preeminent because we're, you know, have so much innovation. However, there have been people on the planet that been around for a long time. And I'm very much, as a community person, very interested in understanding some of those interventions. However, you know, through doing some research, things such as a cell phone in third world countries has really helped them to use technology to actually, you know, jump past some of the things that are going on right here in our neighborhoods. And so I believe, and I'm happy to listen and to try to be a part of this, because I think, you know, there are places in other parts of the world that we have much more in common, especially working in inner city, than we do with folks who are in the same city.
Go ahead, Yolanda.
Oh, I was just going to say, thank you, Ray. One of the things that drew me to Brazil as Rio de Janeiro has similar health outcomes as Baltimore. Even when you look at something as similar, unfortunately, as the homicide rate. You know, there are lots of similarities, but there's also similar assets. And so we want to say also looking at, you know, not just deficit-based thinking with communities, but also looking at the assets. But you raise an important point, because low and middle income countries, because they have low resources, they've had to be creative
Mhm.
and the innovations. And so that's why there's so much opportunity to learn. So I think there's opportunity to learn from low resource countries, but then there's also opportunities to develop proposals that might even examine this idea of bias from learning from from certain parts of the world versus other parts of the world, and also to understand community organizations' receptivity to receiving a global idea. How open are community members to that? Virginia.
Hi, my name's Jackie. I'm from Power Inside. I'm sorry for being late. I couldn't find the Zoom link to get on, and so I may have missed this part. I'm wondering, is it going to be covered how to identify compatible global models to adopt? We're a human rights and harm reduction program and have used a community organizing approach to address certain human rights abuses in Baltimore. And I wanted to kind of just, I've looked at the materials and I don't know if there's like a bank of models or if it's kind of up to the applicant to identify the model on their own.
Well, I can start by saying thank you for your question. And I think identification is a huge initial step for global learning. And there are databases available. The most prominent one is at Indiana University. And we can actually put that on our website. But I think an appropriate project for someone like you who is engaged with a specific type of activity in a community in the United States and has tight ties with community organizations, the process of identifying an intervention that could be useful and evaluating whether it would be useful would be an appropriate project here. So you wouldn't have to necessarily have identified the appropriate intervention to apply for the grant. That could be your proposal. And just to amplify the proposal, the process, it would not, I would suggest not only identifying one or two or three possible interventions that have worked in other countries, but maybe testing them out with your community members and as Yolanda mentioned, testing the community's readiness for different types of interventions that may have been developed outside the United States. So you would be dipping your toes essentially into global learning at an earlier stage, but at a very appropriate stage for this grant proposal.
Great. So we wouldn't be locked into a model from the get-go.
Exactly.
Yeah.
It could be a process of identifying what would be your proposal.
Sure, like you might actually have, if you have time to go through the database, you might identify 2 or 3 different approaches. And, through the process of this planning grant, you can hone in. Part of why we're so flexible is the field of global learning is new. It's really emerging, and we really want to work with people through our technical assistance that we'll be providing, but really learn more about what would it take, right? So you don't have to have it all fleshed out to apply for this grant, but it should be a health equity issue that's important to community members.
Yeah, I mean, there are a couple models we've aspired to in our group work because some of the women's leadership development, it integrates practitioners and organizing a lot more fluidly because women are out organizing and taking on work and practice. And so there's some we aspire to, or we've included certain types of leadership development because it really does work, as Ray was saying in Baltimore. But it definitely I will definitely want to explore more.
Thank you for that. And yes, we'll put those tools that Virginia were mentioning, we'll add it to the webpage. Questions from others?
The second question I have, can you hear me? Is that, do you help connect, let's say I have an idea from the global, from another country, but I don't have like a base here of an organization that I could link up with. Does this program help connect with local organization that I could possibly translate my, what I've learned from there to this country?
So as you could see where when I went through the recommendations, community engagement is highly encouraged. And so we don't have a bank of organizations, but we are asking that our grantees or people applying for this grant have a partner that they're willing to work with. Or that is willing to work with them in implementation. So you do need to have a community partner to apply for this grant.
Okay.
Well, can I ask the flip question to that? Do you have to have in mind the actual other country or neighborhood, and that you want to or that you will be engaging with? Should that be parsed out prior to applying for the grant?
I'll answer that just to say that for that, thank you for asking that. If that is sort of the flip side of the equation, we don't require that for this grant because we understand part of this grant will be identifying interventions from overseas. That said, community engagement on both sides of the equation is very important. So to the extent that you identify or your group identifies an intervention as part of this proposal, we do think it will be important to reach out to the folks who either use or developed the intervention overseas and to bring them into this process. And that's really important for the reciprocal nature of what we're doing. And so I think that is a critical element. But I have to say that in our experience, sometimes some interventions have been used for global learning where it's very hard to discern the who developed that intervention or who's using it. And so sometimes that may not be possible, but to the extent that it's clear that what you're using, for instance, a harm reduction protocol from Morocco, that and exactly who's implementing it there, I think a stronger proposal would include some declaration that you've been in touch with those people or that you will be in touch, and include them in the adaptation and implementation process.
Okay. Thanks.
I wanted to respond to Rodrigo's question in the chat. This is a national grant, so it has a wide reach. And so although University of Maryland is the center, and I know everybody wasn't on here, this is a national program. And so when we talk about community-based partners, we are not talking about in the state of Maryland. We're talking about in your local community, wherever that community may be. And so, we really hope that as global learning emerges, it emerges in a way that it benefits communities and that community members are empowered or are in a position of power to help us drive which projects are tried in their communities. So that's why it's so important to us that you have a community partner.
I have a question. Hi, nice to meet you, Yolanda. Um, and good to see you, Virginia. So two questions, I guess. One is, Virginia, I have spoke about an idea, but I know you mentioned like interventions. And so just checking in if like a broader approach to a social problem is okay, or is it more very public health focused to a particular intervention like harm reduction or something like that? And then the second question was just, I don't know if you've mentioned like the competitiveness, you mentioned it's national, but can you say like, oh, last year we got this many and we were able to fund this many, just to give us an idea of like how competitive or the chances we might have, if we submit?
Sure. So this Global Learning for Health Equity Network was implemented in the middle of COVID in 2019. So this is our first call for proposals. And so we don't know how many people will apply for these grants. So it'll be hard for us to give the chances of it being awarded. We decided to just leave it open and let people apply, as opposed to having a multi-layered application process where we have the first group apply and then the second group apply. We wanted to just have one application. So that's the path that we're on. In terms of the types of projects that we hope people will, it is very broad. For us, it has to focus on health equity. There are many people that are doing global learning, but global learning is not focused on health equity. What distinguishes us, and if you may not have been here for Virginia's definition of health equity, but it's very broad. It can be in health, it can be in education, it could focus on housing. It could have a public health lens. It might not have a complete public health lens. I think it's hard not to have a public health lens somewhat if it's health equity. But I think a lot of them, will be public health, but we're not locked into that. It could be broad thinking. The example I gave was my project focused on building social inclusion. So social inclusion is a really broad concept, right? So for us, it was really about decreasing social isolation, and this was pre-pandemic, and also about addressing social determinants of health, and dealing with things in the social and built environment in a way that it could help people really feel like they were included and part of the environment in which they lived. So it could be a broad concept, but it needs to have a global solution or a global idea that you think could help solve that greater challenge. Virginia, did you want to add to that?
Yeah, just to say, we do use the word intervention, but it could be also be approach, a global idea. So I understand what you're saying. Intervention seems like almost a very narrow project or initiative, but we also support, there may be a global approach that has worked in another nation where it's less of an intervention and more of a bigger approach to dealing with an issue like social inclusion. So I hope it answers your question. We are thinking broadly.
And I'm trying to keep up with the chat too. There was another question about, for those that are funded, will there be cross interaction? And the answer to that was yes. We'll be providing technical assistance and mentorship to grantees, we will have in-person meetings as well as regular technical assistance meetings. I think that's all the questions I see in the chat, but we still have time for a few more. Hearing none, I will think that Virginia and I did a good job of either in the documentation, providing you all the information that you need, or through this webinar. We are here. If you have additional questions, please reach out to us in the email in the call for proposal, and we'll be happy. We've been kind of fielding lots of questions through email, and we're going to develop following this session some frequently asked questions, and also post that on the webpage, so that people have additional information from the questions that we're being asked. But we would encourage you, I had a back and forth dialogue with at least one person that was interested in applying, that was just really trying to flesh out an idea. So feel free to reach out to us by email.
Thank you so much.
Okay, thank you, and the gift of time.
Thanks, everyone. Bye-bye.
Right.
You.
All right, Virginia, you want to hang on for a minute?
Just want to